Bipolar disorder, also known as manic depression, is a mental illness that brings severe high and low moods and changes in sleep, energy, thinking, and behavior. People who have bipolar disorder can have high periods in which they feel overly happy and energized, and other periods of feeling very sad, hopeless, and sluggish. Bipolar disorder is widely believed to be the result of chemical imbalances in the brain. The chemicals responsible for controlling the brain's function are called neurotransmitters, and these include noradrenaline, serotonin, and dopamine. Mercury poisoning can cause a variety of illnesses such as chronic fatigue, fibromyalgia, ADHD, bipolar disorder, sinusitis, tinnitus, balance problems, tremor, insomnia, inflammatory bowel disease, dermatitis, excessive thirst, salivation, and a host of other symptoms. There's now ample evidence for the removal of mercury amalgam dental fillings due to their many side effects, and anyone who has a mood disorder should ensure that they're removed as soon as possible. Just because a urinary mercury test doesn't find mercury, it doesn't mean that you're not being poisoned, as mercury lodges in the brain and it won't come out without a chelating agent. Mercury poisoning affects the body by draining your body's glutathione stores, and glutathione gets used up trying to remove mercury, rather than performing its many other functions that are necessary to healthy living and aging. Glutathione is an important cellular antioxidant, and its levels are decreased in some studies of bipolar patients. Selenium is necessary for glutathione production, and selenium levels are lower in patients with mercury poisoning. You can increase glutathione levels by taking reduced glutathione at up to 1,000 milligrams per day, by taking N-acetylcysteine at 500 milligrams 3 times per day, and by taking the herb milk thistle. The herb's basil, which is also called cilantro, is known to cross the blood-brain barrier and to remove mercury from the brain. And also chlorella works as well as basil for this purpose of detoxifying the brain. SSRIs. Common antidepressant medications can be overprescribed, and one of the side effects of this can be a neurotransmitter imbalance that can trigger a manic state and mimic the symptoms of bipolar. There have been many cases of people who first had a diagnosis of depression only to then get a later diagnosis of bipolar disorder as a result of the SSRI. This can lead to the patient having a lifetime of unnecessary medication and unwanted accompanying side effects. Or it can take months or even years to remedy this imbalance when trying to come off antidepressants. Carbohydrate cravings in patients are legendary, so much so that increased intake of sugar is considered a clue to bipolar disorder during the diagnosis. People who are depressed munch on sugary snacks to make themselves feel better, and then, in the throes of a manic high, mindlessly devour high carbohydrate junk food. You can check out my video on blood sugar to find ways to help improve your blood sugar levels and to increase your insulin sensitivity, such as the supplements chromium, a low carbohydrate diet, a low GI diet or ketogenic diet, and herbs like berberine hydrochloride at 500 milligrams 3 times per day. Sugar control can also help regulate sleep, as high sugar can cause insomnia. Also, eliminating stimulants would be a good idea, as they not only interfere with sleep, but they exacerbate bipolar symptoms, increasing the highs and lowering the lows. Bipolar disorder may affect sleep in many ways. For example, it can lead to insomnia, the inability to fall asleep or remain asleep long enough to feel rested, resulting in you feeling tired the next day. Disrupted circadian rhythms are one of the leading causes of bipolar. You can use blue light blocking glasses, which increase the brain's own melatonin, and they can be effective in mania. or the supplement melatonin will also work on circadian rhythm disorders like jet lag. You can see my other video on herbs to help sleep to learn more about this. Uridine, found naturally in human breast milk, is now synthetically created as a supplement. In a study of 7 adolescents with bipolar disorder, uridine prevented depressive symptoms. It may work by improving mitochondrial function, which is thought to be compromised in bipolar brains. A study of 17 healthy people revealed that uridine also improves phospholipid structure of the nerve cell membrane. Membrane phospholipids may be altered in people with bipolar disorder. And in rats, uridine in combination with omega-3 fatty acids relieve symptoms of depression. Uridine doses can be from 1 to 2 grams per day. You can check out my other video on improving mitochondria to learn more about the mitochondria and the benefits of increasing ATP production. Choline works synergistically with uridine and omega-3 in creating new synapses in the brain. Findings of a small placebo-controlled trial suggest that phosphatidylcholine at 15 grams to 30 grams a day may reduce the severity of mania and depressed mood in bipolar patients. Case reports and case series suggest that choline reduces the severity of mania. You can check out my other video on choline sources for nootropics for more information on the various forms of choline and their different benefits. Omega-3s have been studied in various mood disorders such as postpartum depression with some promising results. In bipolar disorder, the omega-3s may be most effective for the depressed phase rather than the manic phase of the illness. Typical doses can be 3 to 9 grams per day of an EPA DHA omega-3 fish oil blend that's molecularly distilled to remove contaminants. Fatigue is often a vicious cycle in bipolar disorder. High energy levels and restlessness during mania can make it hard to sleep at night, causing you to feel very tired during the day. During a depressed state, however, you may feel fatigued all the time. Lithium orotate, unlike the popular bipolar prescription drug lithium carbonate, which is actually toxic, is instead an essential nutrient taken at small doses. Lithium orotate intervention demonstrated benefit in treating alcoholism and was also associated with improvements in migraine and depression. Other studies show lithium orotate may reduce the frequency and severity of migraine attacks and improve depression associated with bipolar disorder. Lithium orotate helps to normalize many neurotransmitters in the brain. Doses can range from 5 up to 50 milligrams per day, depending upon one's needs. L-theanine is a relaxing agent that's known to relieve stress and anxiety. These effects can also be felt in people with psychological disorders, including bipolar disorder. Some even claim to experience improved concentration. L-theanine makes up around 1 to 2% of the dry weight of tea. Doses of L-theanine can be 100 milligrams up to 1000 milligrams per day. Magnesium, it's found in whole grains, beans and dark leafy vegetables like spinach, and it's been shown to have an effect similar to lithium, the most common bipolar medicine. Upping your intake of magnesium, the natural mood stabilizer, may decrease your need for medication. In order to ascertain your dose, take magnesium bisglycinate and slowly increase each day. Once you reach stomach upset or diarrhea, then slowly reduce the dose until you can find your maximum tolerable daily amount. As magnesium is required for the proper functioning of hundreds of enzymes in the body, its results can be profound after a few months of supplementation. Also, in patients with untreated bipolar disorder, data showed a significant decrease in intracellular magnesium concentration, and also plasma zinc concentration. And zinc is also required by many enzyme systems in the body. Therefore, 50 milligrams of zinc picolinate may also be of benefit here. Many people are vitamin D deficient due to poor diet or lack of daily sun exposure. Recent research has found a correlation between a low vitamin D level and neuropsychiatric illnesses. Specifically, it's been noted that vitamin D deficiency has been found to be associated with bipolar depression. You can get a 25-hydroxy vitamin D blood test and then supplement with vitamin D3 accordingly. Vitamin D works synergistically with vitamin K2. Another study demonstrated that vitamin K2 prevented the development of anxiety and depression. The maximum amount of vitamin K2 that you can absorb in a day is 300 micrograms. Therefore, a dose any higher than this would not be necessary. Vitamin C helps the body to reduce its load of vanadium, and this has been studied for its possible role in the treatment of bipolar disorder. A double-blind trial found that both manic and depressed bipolar patients were significantly improved after just a one-time administration of 3 grams of vitamin C when compared to a placebo. The best form of vitamin C is liposomal vitamin C, and then non-acidic buffered vitamin C, with the worst form being cheap acidic ascorbic acid. Vitamin B1 or thiamine. Anxiety disorder often accompanies bipolar disorder. Vitamin B1 can help ease anxiety and irritability for some adults, according to a 2021 study. There's numerous forms of thiamine available, all with different benefits, such as benphthiamine and sulbuthiamine. Sulbuthiamine is considered to be more of a nootropic for the brain. Benphthiamine is considered more to be an anti-diabetic agent. Psychiatric disorders that may be diagnosed in patients having vitamin B12 deficiency can include depression, bipolar disorder, panic disorder, psychosis, and phobias. Methylcobalamin, when taken under the tongue, is the best form of vitamin B12. Due to food fortification with folate, a B12 deficiency may not show up on a blood test. Some experts believe, on clinical experience, that moderate doses of the herb Rhodiola rosea can be helpful in people who are experiencing bipolar disorder, who are taking mood stabilizers, and whose mood swings are primarily depressive, with only occasionally mild hypomanic symptoms. It's considered an adaptogen, meaning it's supposed to balance all systems of the body. Amino acids have beneficial effects on depressed mood, anxiety, and insomnia in bipolar patients. Taking the amino acid L-tryptophan at 2 to 3 grams per day, or taking 5-HTP, 5-hydroxytryptophan, at 25 to 100 milligrams per day, may be beneficial for anxiety-associated mania. Cortisol is a stress hormone produced in the body. In addition, depression and mania are common psychiatric symptoms seen in patients treated with corticosteroids or suffering from Cushing's syndrome, which is a disorder caused by cortisol excess. There are numerous ways to help regulate your cortisol, such as improving sleep, stress management, the supplement phosphatidylserine at doses of 600 to 800 milligrams per day, and the herb tulsi, which is known as holy basil. Low testosterone in men can also increase cortisol, leading to weight gain, fatigue, stress, and many other unwanted side effects. So testosterone replacement therapy may be a good option for someone over 30. You can see my other video on improving testosterone naturally for more information on this. Known as the 5-flavor berry, Schisandra is a popular Asian adaptogenic berry thought to have numerous benefits for health and well-being. Schisandra chinensis, extracted from Schisandra roots and seeds, is used to reduce stress, fatigue, bipolar depression, tension, anxiety, and weakness. Schisandra is also useful in reducing the adverse effects of other medications, such as antidepressants and antipsychotics. Another adaptogen, ashwagandha root and leaf extract, was shown to have cognitive benefits for people with bipolar disorder. Methylation, the three most common causes of bipolar disorder. Walsh Research Institute lab tested over 17,000 individuals with mental health disorder, and they've correlated the data to find which conditions tend to lead to bipolar disorder. The three primary biochemical classifications of bipolar disorder are as follows. A. Undermethylation. This condition is innate and is characterized by low levels of serotonin, dopamine, and norepinephrine, high whole blood histamine, and elevated absolute basophils. This population has a high incidence of seasonal allergies, OCD tendencies, perfectionism, high libido, sparse body hair, and several other characteristics. They usually respond well to methionine, SAMe, calcium, magnesium, omega-3 essential oils, B6, inositol, and vitamin A, C, and E. They should avoid supplements containing folic acid. In severe cases involving psychosis, the dominant symptom is usually delusional thinking rather than hallucinations. They tend to speak very little and may sit motionless for extended periods. They may appear outwardly calm but suffer from extreme internal anxiety. B. Overmethylation. This condition is the biochemical opposite of undermethylation. It's characterized by elevated levels of serotonin, dopamine, and norepinephrine, low whole blood histamine, and low absolute basophils. This population is characterized by the following typical symptoms. They have an absence of seasonal inhalant allergies, but a multitude of chemical or food sensitivities. They have high anxiety, which is evident to all. They have low libido. They have obsessions, but not compulsions. They have a tendency for paranoia and auditory hallucinations. Underachievement as a child. They have heavy body hair, hyperactivity, nervous legs, and grandiosity. They usually respond well to folic acid, B12, niacinamide, DMAE, choline, manganese, zinc, omega-3, and vitamin C and E. But they should avoid supplements of methionine, SAMe, inositol, trimethylglycine, and dimethylglycine. C. Pyrrole disorder. This condition, also called pyroluria, is a genetic stress disorder associated with severe mood swings, high anxiety, and depression. The biochemical signature of this disorder includes elevated urine cryptopyrroles, a double deficiency of zinc and B6, and low levels of arachidonic acid. Pyrolurics are devastated by stresses, including physical injury, emotional trauma, illness, sleep deprivation, etc. Symptoms include sensitivity to light and loud noises, a tendency to skip breakfast, dry skin, abnormal fat distribution, rage episodes, little to no dream recall, reading disorders, underachievement, histrionic behaviors, and severe anxiety. They usually respond quickly to supplements of zinc, B6, evening primrose oil, and augmenting nutrients. So to conclude, bipolar, depending on the severity, can be a lifelong condition that needs constant management through dietary control, exercise, sleep regulation, stress management, supplementation, medication, and herbal medicine. However, finding many supplemental and nutritional interventions, your medication may be able to be reduced or even eliminated, and your life may be dramatically improved. It can take time to figure out what works and what doesn't through lots of trial and error. Be sure to do this under the supervision of a professional.